In tonight's Health Watch, an operating room robot that promises less painful, longer-lasting knee replacement.
She is brand new, and she is named Rosa. CBS 2's Dr. Max Gomez is here now to tell us how she helps to make the procedure that much better. Doctor?
That's right. But first, we should start out by saying that the majority of knee replacements are very successful. But with more than 600,000 knee replacements done each year in the U.S., even a small percentage that aren't perfect amount to a lot of unhappy patients. That's what the robotic surgical assistant, that's Rosa, aims to improve. A lot of people dream about being a chef in a fancy restaurant. But as corporate chef Lydia Liebschen will tell you, the reality is that you're on your feet 8, 10, 12 hours a day. That meant that when Lydia's knees started to go, so did her quality of life.
It changes your life. It changes the way you think. It changes what you do. Certainly changes the way you walk and work. And there was no out. There was just, you wake up with pain, you're laying down with pain, and there was no end in sight.
Lydia had one knee replaced 7 years ago, and it took 3 months to recover to the point she could be back on her feet all day at work. So when her doctor said a robot could reduce that dramatically, she said, let's do it.
When I was wheeled into the operating room, I saw this big machine with a bunch of technicians standing around with laptops, and I was told that Rosa would be helping with the knee surgery.
The actual procedure is pretty bloody and graphic, so this animation gives you an idea of what Rosa does. What you can't tell is that Rosa allows surgeons to plan the operation before they make the first cut.
It helps us understand the bony anatomy of a patient's knee. It helps us understand the alignment of the knee.
Turns out that correcting the alignment of the leg and knee is only one part of a successful operation. The other is making sure that tendons, ligaments, and muscles of the knee are also well balanced.
You don't get the soft tissue balance right, the knee won't function normally in the short term and likely will not last as long.
And as Lydia found out, having Rosa as a surgical assistant made a big difference in her recovery.
I was back at work after 7 weeks.
Now, Rosa is still too new to really know whether the knee replacements done with her help will really last longer. That's the data that Drs. Levine and Klein are gathering. But anything that makes the artificial knee feel and function more like your own is really a good thing. And both of the doctors helped develop this, so this is their baby. They really care to make sure that this thing works. But it looks like it's doing a lot of good.
Yeah, Rosa has a future. Sounds like it, right?
Rosa's got a future.
Thank you.
A rosy future.
Rosie, for Rosa.
Look at you.
Thank you, Dr. Max.